So next we talk about the constitution. Yeah, so this is in Chinese medicine. Because the constitution is important, so that give you the idea how to differentiate the pattern. Yeah, when it comes to treatment, and also more importantly for prevention. So like okay, after the cancer treatment, yeah. So like what's the next step? Yeah. So in conventional medicine, most times, oh, that's it, pretty much it. So come back to for the follow up. Yeah. But in between, nothing. Yeah. So this is the part. Yeah. This is from different angle. You look at okay, your bodies tend to be in that particular characteristic type of constitution. So if you can try to correct that, yeah, so that you have much higher chance to prevent that cancer from recurring. Yeah, so that's why. So you look deeper, it's about the genetics basically. So the balanced constitution, that's pretty much the best. Everybody wants that, but unfortunately, it's only a small percentage people who has that constitution. That's the grandpa who drink every day still live over 100 years old. That's the grandma smoke every day, never go to the hospital in her whole life. Yeah, but unfortunately, we're not like that. Yeah, everybody is a very small percentage of group that can have that. The first one is the qi deficiency group. We're talking about what is qi deficiency. It's like your thyroid function, your adrenal function is on the lower side, or because of other genetic issues or other conditions, you tend to have that. Yeah, and so this is different. Yeah, they may tend to have cold, flu. Yeah. They have those issues. Speaking of that, there's a very interesting phenomena in oncology. This is from back then, when I was in medical school. So they discovered, the people who frequently have cold and flu, their chances to have cancer actually is less compared to the other group. So meaning being healthy, it's like you keep having those. And actually, it makes perfect sense is because you keep having your immune system can exercise all the time, especially that particular group, your SWAT team, the natural killer cell. Yours probably, if you have a couple of rounds, your level is very high. So they can monitor the cancer cells closely. So they have much better chance to kill them. Yeah. And compared to the other group, never get sick is your SWAT team is probably asleep all the time. Even there's something wrong, they cannot detect it, they cannot check it. So that's my interpretation that I call that. Yeah. And so we do know that it's actually, by the same token, and if you keep having frequent flu or cold, and so besides the natural killer cell, the whole system, because every time you have it, there's like a coordination effort. The body needs to basically look, like what's wrong, okay? So some parts they can pick up those problems, normal, otherwise you just missed. Yeah. So that's why. So don't feel too bad if you have cold, snuffling, and sneezing, and you just know you one step further from getting cancer. All right. So the yang deficiency constitution, this is mostly what we see is people with adrenal fatigue. Adrenal fatigue is become like a real. They used to think, you check the numbers, so your adrenal seems okay, but that is what we call the yang deficiency. They tend to be cold all the time. Yeah. They need to get heat and warmth, anything warm. Yeah. So those they cannot tolerate the winter. This type. Yeah. And so from Chinese medicine point of view, a lot of the cancer patients actually is probably due to yang deficiency, not enough adrenal function. Your immune system is weak. So the body is what we call congested. So you have a lot of those congestion, and from the congestion, turn into the toxin. So the toxin accumulation turn into inflammation. So that's probably from different angle. Yeah. So if you have this, so this is the one area. And because a lot of people, we talking about being healthy, drinking a lot of water. Yeah, so like, okay, 8 glasses or more. Always the mentality, right? More is better. So if after drinking the 8 glasses of recommended water, you get lethargic, you get the fatigue, you get sometimes like the stomach don't feel right. So probably what you have the yang deficient type of constitution. Means you cannot handle that much of the water. Yeah. So cutting half or even more, right? Yeah. Instead, try to work on the adrenal function. Boost that adrenal function, probably will be better off. There's the indeficiency constitution. Remember the previous photo, that with a lot of those cracks, right? Yeah, the geographic type of tongue. So this from study actually showing, when you have indeficiency in female, most times like around the menopause. Yeah. So that we know, okay, if you have your estrogen decreased, dropped, you may have this. Yeah. So you go one step further is when you look at the immune system, the T cell system versus the B cell system. So there could be sometimes after a cold and the flu or infection, and so you may have a few days you can't sleep, restless. Yeah, you feel like that's like very anxious, anxiety. So that is probably because the body produced too much of the antibody. So too much of the antibody, it becomes irritation. Yeah. So that is what we call indeficiency. So that may show up on the tongue. You see that cracked and the geographic-like tongue. Yeah. So this is the type that you need to address, especially right around the menopause. And if you're not a big fan of taking the hormone replacement therapy, so there's some other treatment from acupuncture treatment and those certain food you should eat that will help to change that. Yeah. There's another constitution called with the phlegm and the damp. So this is basically congestion. Yeah. So we have patients like, okay, even drinking water to gain weight. Yeah. So they're more likely to be their adrenal function is a little bit lower, but they tend to the ability to process the fluid, the water, is in trouble. So that they may have issues because of that, diabetes, stroke, and coronary heart disease, and this is the type that actually should worry because the chronic inflammation from that. Chronic inflammation means too much toxin accumulating in the system. And heat, this is the tend to have infection or the yeast infection, fungus infection. So that type. And so there, if you check their blood, the inflammation marker could be always higher than other. Yeah. So if that's the case, you try to eat the food that help to lower that trend. So it's like always, this is the type you should eat a little bit more salad or cooling food, try to cool it down. This group is what we call the qi stagnation. In short, you heard the type A personality, right? So what is a type A personality? It's what we call the qi stagnant type. So no matter what, they're not happy. They're depressed. Yeah, doesn't matter what you do, what you eat, that doesn't matter. Yeah. So this is the group because you're stressed, like we explained earlier. The liver is under stress, so the whole body cannot function. Yeah. So over a period of time. Long period of time, that could be big trouble. So a lot of the breast cancer patients, they did study showing, about at least like 1/3 or more, they have depression to begin with. And most times is what? Undiagnosed depression. So that we translate into TCM language, that's the qi stagnation type. Well, the therapy is just simple, be happy, right? Yeah, we always say that, be happy. Try everything we can, be happy. So the next group is called blood stasis. Yeah, so this is actually the pattern in integrative medicine. This research is the most. Yeah, so basically, we're talking about the circulation. We always use the term, oh, you have a poor circulation, but that's not all. Poor circulation could could be meaning so many things. Yeah. And remember the purple tongue we said earlier, see that, yeah. So that is a sign of blood stagnation. I'll give you an example. One patient came in for shoulder pain. Yeah, and this is like it's a nurse, a few years back. And so shoulder pain. So okay, we do acupuncture, we do needles, and so that's better. But what I have noticed is like her face is extremely like red. It's like, okay, do you always like you have this red face? They're like, no, just for the past couple of years, it's getting redder and redder, almost like purplish. And she's hiking, she's pretty much the typical, yeah. And so she went to see, the shoulder is better, but she already scheduled to have MRI. And so it happened to be the tech, she knows because the same hospital, she's a nurse. And so they did a little bit lower and the right side. And so they noticed, something funny. It turned out to be actually kidney cancer. So just from that, right, okay, oh no, that makes perfect sense because that is what we call the blood stagnation. And she just has this unpresented, like blood stagnation, she never. Yeah. So eventually, of course, since it's very early surgery, and so she didn't need any other treatment, she's still fine. Yeah. So that's why, we know, of course, nowadays, we have, CT scan, we have MRI, we have all the blood, but the typical, like the very simple change of the complexion. So any change, there's like a pay more attention to our body. Any change, because we tend to put down our intuition. Yeah, like, oh, okay, oh, get better. Yeah, that'll be something, So if there's intuitively anything you feel is not right, just go to check it out. This is one example. This is like, okay, she happens to have this, what we call blood stagnation in the pattern. So this is called like a special intrinsic constitution is basically the allergy type. They tend to, some people, right, they tend to be allergic to everything, right? Yeah. So this is super sensitive. So allergy, in typical, when you have allergy, you don't have a weak immune system. You have your immune system just not in harmony. This is the first thing. Yeah. So try not to use. A lot of times people say, oh, you have allergies, you have a weak immune system. Try to boost up the immune system. That makes the allergy worse. Yeah. So they're just not balanced. Yeah. Your own, like the SWAT team cannot recognize the enemies. They always take their own, the autoimmune diseases, right? Their own tissue, own cells as enemy. Or they're happy. This is like ultimate proportion, reacting to pollen, other flower, leaves, and that type. So this is basically, that the idea is like how to lower that sensitivity, before you increase the immunity. It's like, okay, actually try to balance that. Yeah, so there's a way to tell. Yeah, okay, yours is like your the T cell system is overactive, your B cell system is overactive, how to balance it, harmonizing it. Yeah, so there's a different way to address that.